At New Beginnings, we believe in embracing beauty from the inside out. As a proud sponsor of the Miss Louisiana organization for the past 4 years, we understand that confidence is often a precursor to success. Our med spa offers a full range of aesthetic and skincare services tailored to meet your unique needs. We're here to guide you on your journey to radiating beauty and confidence. So we're about to do Morpheus on my friend here, and she has had 2 years ago, she had a series of 3, and now we're just doing another one just to like go in with the microneedling and the radio frequency and remind her skin, hey, keep making collagen. You see she's lean. She's a marathon runner, has been for decades. So we can't tell our bodies to hold on to fat in places where we don't want to lose it. So Morpheus is wonderful for stimulating that collagen and also just for overall texture, reducing pore size. And will we achieve a little improvement here in the neck? That is not something I would promise any patient. I would under promise and over deliver. I would say I would not bank on it. Maybe we'll achieve a slight improvement. So what I want to do with her next time I see her is I want to treat her neck. After I've done the Morpheus, I want to treat her with hyperdilute Radiesse in her neck, which is a calcium hydroxyapatite filler that I can dilute with normal saline and place it superficially into the dermis to also stimulate collagen and elastin, both. It's pretty fantastic treatment. I've had 2 hyperdilute treatments in my neck. So it's in aesthetics, there's really not a one and done unless we go have a facelift with fat grafting to replace the volume. That's a one and done. And not all women want that or can afford that. So what are our other options that can help us have birthdays but have them gracefully and not wear all them birthdays on our face? Is these types of treatments. But Mary Martha exercises, she eats well, she hydrates well, she's got balanced hormones. So doing then procedures like this can help optimize those other good things she's got going on. And I've numbed her for over an hour with a beautiful compounded topical numbing cream that has really, really made a huge difference in my patient's comfort with this treatment.
How long is the treatment?
Oh, will probably take us 30 minutes. Because again, this is not a first time for her. This is just
How long
to give her.
Before she can start seeing results? Will it be pretty immediate? Or?
I mean, immediate with texture improvement and brightening, that's immediate. The collagen building aspect is very individual and takes time. So if I'm treating her, if this was her first time to have this Morpheus treatment, you know, we do the series of 3, 1 treatment, 6 weeks apart. And then once we have the 3rd treatment, I usually wait and have the patient return in 3 months just to take some follow-up pictures. And I've been really impressed when I get to go back and look side by side. The improvements might be subtle as far as like when you see a neck that's got a mild bit of laxity. But I immediately see reduction in pore size, reduction in the fine lines, and just an overall brightening, which I love because that makes us youthful, because you see what a great complexion she has. So because she's lean, I'm not setting the depth at which these pins will deploy deeply. I'm not trying to nuke her underlying fat. So I'm going to 2 millimeters only. And I'm going gentle on my energy as well, because I need to be very aware of a lean woman who's wanting to preserve those deep fat pads, but we're just wanting to improve the underlying collagen and then optimize texture, tone, and just the way I call it our tablecloth. we want it to be beautiful because the underlying structures are the problem with aging. We lose bone, we have absorption of those deep fat pads, you've got gravity working. It's layers of things. Some of that is, I can't go in and add bone back. So that's why these procedures can be underwhelming for a woman who has a lot of laxity. So those women, I almost beg for them to go at least have a discussion with a plastic surgeon. And I tell them, you may be pleasantly surprised that it's not as expensive as you've imagined it to be, and that it's not as lengthy, it's not like a long downtime. I had an upper and lower blepharoplasty over a year ago with fat grafting to my under eye area. I was very amazed at how reasonable all that was. And the recovery was a little over a week. I was bruised, that was the main thing, but nothing I couldn't deal with. Okay, I'm gonna do one. You tell me what you feel. How was that?
Fine.
Can I ask you a question, Sarah?
Yeah.
So what's the difference between Morpheus and traditional microneedling?
This has the radio frequency aspect, which like skin pin, which is just microneedling, does not have that. It just has the needling aspect. And I can go deeper, are you okay? Mm-hmm. I can go deeper with the Morpheus than I can with skin pin. Skin pin limits me in how deep we can hit down into the dermis. I love skin pin. I like getting it. Donkey kick me if you're hurting.
So much better.
So what do you recommend they do after treatment to maximize their results?
Okay, so when I'm finished, I'm gonna apply our Zeo extra firming serum. It's like a concentrated, and so with the microneedling aspect of what we're doing here, we're opening channels down into the dermis. So we wanna optimize these next like 48 hours while we're able to pour all these yummy nutrients down into these channels to stimulate skin rejuvenation.
Does it help with acne scars, or is it just for skin tightening?
No, it definitely can be a game changer for acne scars. But that's a process. Again, like everything I've talked about, it's not just Morpheus. We may have to do some excising of acne scars to remove the tether. So like when you look at acne scarring on top of the skin, and why some modalities seem not to have any impact on that, it's because those scars are tethered down underneath. So depending on how deep a person's acne scars are, I might take a cannula like that I would use to place filler, and I just might go in to aggravate the underneath of the scar to untether it from the supporting structures beneath it. So then these modalities like Morpheus, skin pin, the other things that we might do to help treat that are going to be more effective.
I can't believe how it didn't hurt at all.
Can you talk about what's the difference? Oh wait, no. How many sessions are typically needed for noticeable results?
I always recommend a series of 3 because it is not plastic surgery. I'm not cutting away anything. I'm only trying to stimulate her body's production of collagen. So we have to so basically the purpose of the series of 3 is to go in and say, okay, keep doing that. Hey, okay, 6 weeks later, keep doing that. Just to keep the body in that building, and then the yearly touch-ups, just to keep the skin from just regressing, getting dry, thin. And we want to use good skincare. We want to make sure, because she runs all the time, she's outdoors, that she's using her sunscreen, because that also is huge in protecting her results.
Is this just for treating the face?
No, I've used Morpheus very successfully on other body parts. I've treated thighs, like the crepey skin around the knees. Now, I will be honest, this handpiece that I'm using on her right now is specifically the face handpiece. So it doesn't go as deep as Morpheus platform that has the body, the Morpheus body handpiece. So if someone is coming to me to say, hey, I've read about Morpheus, that it can help with this area of concern, like loose skin around my belly button, I want to evaluate that person. I want them to come in for a consult. I want to look at them and try to make the best decision I can. Do I think with this handpiece, with how it limits the depth, is that patient going to get a good result? And if I'm thinking they might not, then I'm going to punt them. I'm going to say, hey, here's this colleague that I know has the body handpiece. You should go see them.
How can you compare like a treatment like this versus like Botox when treating wrinkles?
Okay. Tox neuromodulators address muscle movement. So it's repeated muscle movement over weeks, months, years. Just the way your body animates, the way your face animates when you talk, laugh, smile, when you're concentrating. So think about the cumulative effect of the underlying muscle movement that can have on the outer skin that we see. So that's where the deep lines, like the 11s in between the eyebrows, that's how that forms, is from the underlying muscle movement. So Morpheus, though it can help, if say the person has had that expression, I laugh and tell my clients, I said, you've been making that face since you were in utero. You know, because some people just have that. They concentrate, they furrow, and they make that face where they're crinkling themselves in between their eyebrows. And so then you'll just see on their face, even when they're at rest, they've got those two entrenched lines. And I've had women say, well, can't you put filler in there? I'm like, heck no, not there, because it's too vascular. A potential complication of putting filler in that part of the forehead is blindness. So no, I'm not going to put filler there, but we may have to Morpheus if somebody has deep entrenched fine lines. So it's a combination of treatments. But that's where the consultation is so important, especially if someone is naive to all of this and they've never done anything. We need to have a chit chat, and we need to discuss your goals, your concerns, your budget, like all of that, because very infrequently through the years have we had anyone come in and be like, do what you want. Do what you want. Money is no object. I mean, very rarely has that been the type of client. Because I think most of us are like, well, yeah, but, you know, I have this budget. So that's where we lay out a plan and talk about all the options that we have that suits their budget. We talk about, like, do you have an occasion? Is that why you're doing this? You have something special coming up. So how much time do we have? You know, how do we prioritize? So that's where the consultation comes in. Sometimes people make a consult appointment with me to talk about these types of things, the injectables or Morpheus. Sometimes then I want them to go have a consult with one of the estheticians to talk about BBL, Moxie, and those kinds of modalities. So that's when they'll go meet with Robin. So we try to just individualize it to each human and what they want. Doctor's visits are not worth your time and money if you do not get to the root cause of the underlying problem or condition. At New Beginnings, we believe in the power of preventative care as the foundation of your wellness journey. Our approach goes beyond treating symptoms. We're dedicated to uncovering the root cause of your health concerns to ensure long-term vitality. With over 25 years of experience as a healthcare provider and functional medicine practitioner, I'm committed to leaving no stone unturned in optimizing your health. I've helped countless patients with problems such as infertility, cardiovascular issues, nutrient deficiencies, thyroid imbalances, and many more. Our care is comprehensive and personalized. We not only address your current needs, but also focus on preventative measures to keep you thriving in every season of life. Here, you will never be dismissed. We provide premier holistic healthcare utilizing 21st century technology that is tailored to your unique needs because your wellness is actually the priority. It's time for you to feel informed and empowered by your healthcare provider so that you can get back to caring for your family, serving your community, advancing in your career, and enjoying the life you have.